Now we're official.
Mhm.
Okay. I feel like this is one of my most favorite things to talk about because who hasn't felt a little anxiety along the way? Oops. Um, so what we hear is anxiety, worry, stress, all part of people's daily lives. But just because you experience anxiety and stress doesn't mean you have a diagnosable anxiety disorder. In fact, what we hear, but not always agree with, is that anxiety is necessary warning to a sign of danger or difficult situation. So sometimes it can work in our favor if we have no way of anticipating what's going on. Sometimes our bodies tell us, right? A lot of us are familiar with the body keeps the score. Sometimes we can sense danger. Sometimes we don't give kids enough credit because how could they know, quote unquote, but they can feel it in their little bodies as well. So again, kind of thinking about what's the difference in the term anxiety and the word fear. So I'll just kind of ask you all, do you have a kind of a working differential split of the two? What is the difference in fear and anxiety? It's a hard one. They overlap. Definitely when our fears continue, that means the anxiety can continue. So sometimes it's, I'm afraid of, okay, we start to be more and more afraid of something that is kind of, we're kind of leaning towards, okay, all right, kind of maybe we're headed into some generalized anxiety disorder. When does it become a disorder? So here's where we kind of see the criteria kind of coming out. When the symptoms become chronic, okay, so they're ongoing. So chronic is ongoing versus acute one time or two times, and interfere with our daily lives and our ability to function. So often that is kind of the case for a lot of the diagnoses is, our daily lives are affected. These feelings of anxiety are out of proportion sometimes to the actual danger, and they can last a long time. So we know that symptoms can start in childhood or the teen years and can continue into adulthood. Those who suffer from chronic anxiety often report the following. It's not going to read off here, but just kind of this is the list where you're working with somebody, their hands get sweaty right before this, or they're always sweaty, constant worry, can't turn it off. A lot of times we hear stomach is upset. So there's where we kind of like, where do you feel the anxiety? Oftentimes people have upset stomachs. These severes are so severe and upsetting enough to make individuals feel extremely out of or extremely uncomfortable and then sometimes out of control and helpless. I would even add hopeless at times when there feels like there's no stopping it. So what are the different types of anxiety disorders? So fall into a separate set of diagnoses depending on the symptoms and the severity. So these are the ones, hopefully, we'll get to today um, that are different types of diagnoses of anxiety. And again, some more severe than others. So a lot of times we hear it referred to as GAD, generalized anxiety disorder. It's more than the normal anxiety. Um, and again, sometimes when I'm working with individuals, I don't say that they're not exaggerating, but it's just kind of that heightened sense of worry and tension, even though nothing seems to provoke it. So that can be what's really frustrating with individuals is I can't see a trigger for it. I don't know what's causing it. And that can be really frustrating because a lot of times it's like, well, let's figure out what's causing it. Well, I tend to work backwards of if we can't figure out what's causing it, let's work backwards and work with the symptoms. Let's treat the symptoms and see if we can come up with a plan. So just always anticipating a disaster, just thinking through the day, at any point this could happen, which means sometimes just getting through the day provokes anxiety. Now, everyone always asks, like, is it situational? Yes. If we are going to a stressful job every day, it's hard to flesh out, okay, if you left that job, Would your heart palpitations calm down if you didn't interact with the boss? If you were always being scrutinized, if your stomach was always hurting, concentration was always down, fear of being ridiculed, would it go away? Sometimes we don't know, but the hard part is we can't always just walk away from an obligation or parenting, even though sometimes we want to. But you've got to, so that's when we have to figure out as best we can how to alleviate the anxiety. What's it feel like? Just the overwhelming need to shake the concerns or fears, even though we can't. And just more intense than the situation warrants and kind of the irrationality around it. Now, we're not in the business of saying that's irrational. So a lot of times we're working with families, partners, spouses, we say, or parents, make sure not to say it's irrational. Nobody likes to be called irrational. Maybe we say, that's a lot of worrying. It seems like it's taking up a large part of your day. It seems like you're unable to relax, and kind of noticing that about people calmly, or kindly. But, it looks like you're kind of always in a constant state of worry. And you said you've had trouble falling asleep or staying asleep. So kind of some more strengths-based perspectives than you're being irrational. Again, here we look at the physical symptoms, nausea being one of them. Maybe you startle more easily. Sometimes if you're really nervous about a situation, your hands might tend to shake. The having trouble concentrating, that could be age 3 till 100, where we oftentimes see anxiety, the trouble concentrating is maybe grade school, middle school, high school, where somebody looks like they just kind of check out. Okay, they're not concentrating, and it looks like, do they have ADHD? What are we looking for? But that's when a lot of times if we're working in a school where the counselor, it's like, has anybody asked them if they're worried about something? Are they just checking out because they're spending so much worry? It's easier just to check out. And then we know that anxiety disorders can often walk hand in hand with depression. Okay, it can be so depressing to feel like this all the time, to constantly feel like danger is coming, to constantly have your body react with sweating, upset stomach, so on and so forth, that depression can start to set in. We're looking at a comorbid diagnosis. How does it affect daily life? Okay, usually the impairment associated with generalized anxiety disorder. Oh, we are on slide. Oops. I tell what slide? Did I skip one? At the top, it says, how does it affect daily life? It's got a, okay, they overlap a little. It's got a picture of the guy sitting there looking terrified with his covers about to put him over his head.
Okay, yeah.
That one? Okay. So the general impairment associated with GAD or generalized anxiety disorder is mild. And people with the disorder don't feel too restricted in social gatherings. We're going to talk about when we do feel restricted in social gatherings. Unlike many of the other anxiety disorders, individuals with generalized anxiety don't typically avoid situations. However, if it gets more severe or more debilitating, that's when we see it kind of switching into avoidance, not leaving the house. I think it'll be interesting when we start to do the research of, we know that there are some people, we don't know how many, we can probably say that haven't left their house since COVID 4 years ago. Or if they did, maybe it was not for very long periods of time. But if you could order your groceries, go for walks outside, work from home, wave to people from your window, if you know that you're safe where you are, that's kind of that next level of avoidance, okay? Versus getting back out into the world, kind of risking, do we know who might have COVID or not? That was always the big, I feel like, do we know who had it? Someone used to get it, is how do we get it? How do we stop it? Who had it? So definitely a lot of anxiety around health, obviously, during COVID. When does it start? Mostly hits in childhood. It can begin in adulthood, but oftentimes when we start going back through someone's history, they can say, you know, in the 6th grade, I was just so bullied and worried about going to school. I just spent the next 4 years through high school being worried about being near people who embarrassed me. And then in adulthood, it's kind of manifesting in different areas. Here is that time frame where we're looking at. So if somebody spends at least 6 months worried excessively about a number of everyday problems, okay, so we can say, how long has this been going on? I don't know. I've been so anxious for forever. We do our best to kind of build a timeline and go with there, but that can be a little bit subjective when sometimes it's like, I don't know what I did 3 weeks ago. All right, well, then we move here and now and forward, trying to figure out if we can find kind of a length of time. We are looking at excessive anxiety and worry more days than not. So we say, you know, how many days a week do you think you might be worried? 5, typically 5 days a week, 4 days a week, 3 days a week. Okay, the more days a week for 6 months, the more clearer the diagnosis becomes. Again, that can be really subjective when diagnosing if we can't remember how many days. So that's when we ask somebody, okay, starting on March I don't know if it's today's the 8th or whatever, how often do you find it difficult to control the worry? You can notice you're worried, check in with your body, continue to be worried. Specific symptoms of, move this out of the way, of generalized anxiety disorder. So we've talked a little bit about that. The big key here is children do not need to meet as many criteria. So as long as a child reports one of those criteria, we can kind of start with the kind of, I would call it investigation to see what else is going on. Again, that 6 months, a lot of times time is really subjective to kids. So we're a lot of times relying on caregivers, parents. Sometimes we're asking teachers, you know, how often do you notice them just being a little bit restless or on edge or difficulty concentrating? We know sleep. We're going to talk a little bit more about that. That can just in itself, lack of sleep can really affect the next day, as can worry affect the sleep. So it's like chicken or the egg, but we're really looking at those patterns around sleep disturbances. Symptoms in children and teenagers. So in addition to all the ones already mentioned, children and teens who have generalized anxiety disorder might have excessive worries about the following, okay? If you are of a high achieving household, you might be expected to have a high performance in sports, ballet, the play, grades, maybe being on time. You know, I don't want to be criticized for being late. We can say right now in Nashville, Tennessee, earthquakes are not as common. Tornado drills are the ones we do at schools. And the most often drill we do right now is active shooter drills. Okay. So definitely Nashville community and surrounding counties all over the United States. But we had a mass school shooting 1 year ago. So we are heightening up the drills at a lot of the schools to really see what works. We have seen that these drills, some of them are planned. We're seeing more often than not, they are not planned. Okay, so kids are just expected to follow the plan as if there was a shooter, and then just refining that process. A lot of fear around that. And can spend your whole day kind of fearing that danger. It can affect your confidence. Maybe you start to lack confidence if you're not always getting it right. You strive for approval. Okay. Just hearing that you're doing a good job, or you did it correctly, requiring a lot of reassurance. One of the reasons that many reasons that I stopped working with children and families is because they come with a set of caregivers, maybe a parent, two parents, maybe three parents, step parent, what have you. But if we can't get the parents on board, to look at perfectionism as perhaps something that's making their child anxious, it's going to be hard to work with the kids. If we can't get parents to see that giving them a little extra reassurance doesn't make them weak, it's hard to work with the child. Okay. So the more that parents kind of minimize the symptoms or kind of argue with us, and again, it could be out of guilt, the harder it is to kind of make a difference because we need the parents to be on board to kind of, on the off weeks or off days, put some of these practices into place. So those caregivers can definitely be a barrier. What causes generalized anxiety disorder? We really don't know. Just like a lot of mental health conditions, we don't fully understand what causes it, but we know that it could include genetics as well as several other risk factors. Maybe talking about those. So it's looking at both, is it, in your family history of diagnosing anxiety, what are the risk factors going on in your everyday life that cause excessive worry or concern, fear of danger? Risk factors, personality. This one's a little bit subjective to me, because I think sometimes we say somebody is timid or shy. Maybe they're just an observer. I always say, oh, that child's really shy. Maybe they're just kind of reading the room and assessing the situation before they interact or engage. Negativity. If everything is always going wrong, you're always scared that that person's going to hurt you. It's never going to work out. I'll never make it. It's not going to necessarily cause anxiety. It's going to be harder to fight it. Therefore, we might start to avoid anything that we perceive to be dangerous. I can't do it. I can't play on the baseball team. I'm going to always strike out. The coach is going to hate me. My players are going to make fun of me. Well, we've never had that happen. Sometimes we ask, like, what's the baseline for that? It could be just anticipatory anxiety. Women are diagnosed more often than men. And again, I think sometimes societally or gender specific, we think, or in the past, men haven't been able to express their feelings as much or stuff it down. Generally, not always, females are more encouraged to express how they feel, talk more detail about how they feel or what's going on. So there is that, okay, that would keep somebody talking about it. We'd get more symptoms. If someone is buttoned up or squelched, they might not talk about it. So I grew up within a family that we talked all about feelings and what we thought and our reactions, not all the time, but it was welcome to tell my parents if you were worried. My husband was in a family that a lot of times said, man up, get over it, move on, get past it. So at an early age, he just kind of learned how to get over it. Has he? He says he has. He's not anxious at all. Baffles me. Go through everyday life, not anxious. Other mental health issues. Some of the disorders that commonly occur with GAD are phobias, panic disorders, said depression, substance use. We're using substances to potentially numb ourselves, get through situations, and of course, PTSD. What's the best treatment for generalized anxiety disorders? The main treatments, as we know, are psychotherapy and medications. Oftentimes we say that somebody might benefit from both. Psychotherapy can be very time consuming. It can also be very costly. Therefore, we see sometimes, let's start a medication and see if we can't kind of get the system under control. We have the opportunity to get help otherwise. That is oftentimes a privilege. One thing to remind our clients or our patients or our students, it's sometimes trial and error. We don't always know what is going to work best. And oftentimes it's just trying to figure out, oh, that doesn't work. Okay, that's not going to work. This might work, or this has started to work. So just because something doesn't work the first week you try it doesn't mean it won't work, or there aren't other ways to figure out how to manage it. CBT, working on reducing the symptoms. Research tells us it's one of the most effective forms for generalized anxiety, typically a short-term treatment, focusing on teaching specific skills to gradually return to the activities you've avoided because of the anxiety. Okay, so we all, I think, have learned enough about CBT. We have the little circular chart here. It could start with the thoughts and our feelings, head towards the behavior. It could start with the behavior that influences our thoughts and feelings. So trying to figure out, we can't always, like, where does it start? That does not matter if you can't pinpoint it. A lot of times we're then just focusing on how to treat the symptoms. Medication. A lot of times we can benefit from antidepressants, always looking at side effects. The SSRIs, SNRIs are usually the first line. And then Lexapro, Cymbalta, Effexor, and Paxil are the antidepressants that are used to treat it specifically. So included in that, buspirone, how do I say that? Buspirone, a medication may be used on an ongoing basis, okay? So it could take several weeks to become fully effective. So it's reminding our clients, patients, what have you, this might take a while, okay? It's going to take a while for the side effects maybe to be alleviated, what have you, and then for it to just start working in our system. Our benzos, we know that there can be a danger with the anti-anxiety medications. I think the ones, that stick out the most are the 4 examples here. And we know that they can be habit forming, typically are prescribed on a short-term basis. I have a fear of flying, let's say. The doctor may prescribe 3 Xanax or Valium or Ativan, 1 for the plane ride there, maybe after the plane ride, maybe on the plane ride back. So again, if that's a short-term intervention, we know it can be addictive. So Publix, Target, Walmart, CVS, if you start going to different doctors who are prescribing it because you need more, you might be flagged because a lot of these systems are starting to overlap. And doctors who maintain a boundary of, it was just to get through the flight, the funeral, the few days after the funeral, get through a trial, what have you, short-term intervention. I don't necessarily speak to this. If someone says, can it be habit forming? I will say research says yes. Someone will say, I've had a problem with drugs and alcohol before using it recreationally, but to treat anxiety. And then I found I had a problem that could interfere with it being a short-term intervention, because our bodies sometimes really like how we feel when we have drugs, alcohol, Xanax, what have you. And so it's really kind of watching that, unable to function without them, can be a slippery slope. And again, I always say, what did your doctor say? What did you tell them you needed it for? I need more of it. Are you on another flight? Just kind of talk with your doctor about that. We're typically the ones that actually point out it can be habit forming. A lot of times people are at the doctor, your flight. Yeah, you got this and that. Oftentimes, doctors, and not to a fault of their own, psychiatrists, nurse practitioners might not have time to go through maybe a substance use or abuse history. So if we know that about them, sometimes we'll say, can say, did you tell your doctor about that? I didn't. I'm wondering if your doctor would have prescribed that had they known. Maybe so, but perhaps go back and talk with them. So here are just some lifestyle changes. Again, oftentimes, do we have time to do any form of physical? I don't think running or walking is just necessarily what it means. It could be stretching, it could be yoga, anything just to kind of work on our physiological system. Avoiding alcohol or other sedatives. These can worsen anxiety, especially if the next day you might not remember what was going on and you start to feel guilty. Anxiety can come hand in hand. Now we have a lot of apps for managing it. The Calm app, not managing it, helping with relaxation. The Breathe app. I am not one to meditate successfully. Love to give it a try, but if I try on my own, my mind goes to my grocery list. So I do like a good guided meditation. We know that sleep, yeah, not going to make or break us, but sometimes a good night's sleep can help us wake up just with starting off with just a little bit of a clearer mind. I do not like the last one, eat healthy. I meant to cut that off of there because I think eating expensive foods, that's a luxury and a privilege. So I just think sometimes when we tell somebody to eat healthy, have you tried watching what you eat? That gets a little hairy. Okay. Plus, we're not considering sometimes can people afford to go to the grocery store and buy from this and this? We also aren't really considering culturally at times what families or communities consider healthy or foods that treat. So sometimes it's like you might be using what you think is healthy and listing that out. Kind of just encourage maybe to just stay away from that a little bit. Coping. Again, I think the one that really makes me laugh, if you tell someone, let it go, don't dwell on past concerns, change what you can. Okay, well, if you're super worried, someone being like, let it go, you might want to pop someone in the face. Okay, that might not be what you want to hear because you can't let it go. Sometimes it's asking individuals, just when we're trying to come up with something, I'll just say, do you want to never say make a list, but would you like to make a list of things you can control and things you can't control? Well, you want to just make lists and let's process through those. Those that you think you can control, how? Those that you think you cannot control, any of them that might be in the future or right now you can do nothing about trying to think, this thing coming up. You're going to have to face it when you get there. There's as much preparation as you can do. Anxiety support groups. We know from your groups class that groups can be really, really cathartic. We're finding more and more on the internet that are listed lots of different times. You can do it from the luxury of your own home. Sometimes they're free or a more affordable option. Panic attacks. I always think of Lizzo. I'm about to have a panic attack. I love that one. I'm like, that was so clever. Sudden episode of intense fear that triggers physical reactions when there's no real danger or apparent cause. So if you've ever had a panic attack or nobody knows someone that has, it can be really scary. Sometimes you might think you're losing your mind or that you might be dying, right? That you might have a heart attack or that you're having a heart attack. If your heart is racing, you can't swallow very well, your stomach's hurting, muscle tension, it can be really, really scary, especially when we don't know what caused it. Okay. I don't know what I was panicking for. There's no apparent danger or cause for it. Okay. So now we're kind of looking at when does it become a panic disorder? So oftentimes individuals may have just one or two panic attacks in their lifetime, and the problem may go away, perhaps when the stressful situation ends. Okay, so we know that we're going to have to get through a really painful funeral. We are dreading this funeral. We have lost a loved one very close to us. The thought of going makes us panic. The thought of sitting through it makes us panic. Once the funeral is over, perhaps we start to grieve. Sometimes the panic attacks subside because we've made it through a very stressful situation, painful situation. But if you've had recurrent, maybe unexpected panic attacks, and if you've spent long periods of time in constant fear of another attack, you may be diagnosed with panic disorder. Okay. So again, recurrent, unexpected panic attacks. We don't know what brings them on, right? And when you're having a panic attack or you've had a panic attack and somebody says, what do you think brought it on? Once again, you want to punch them in the face. If I knew what brought it on or how to help myself, chances are I would have tried, and that's not helpful. But if you're supporting somebody, those are sometimes just the thing, what do you think happened? I don't know. They oftentimes feel worse than they actually are. Just that impending doom. Okay. Even though they're not life threatening, we can start to go into, again, I might die. And it can affect your quality of life. Okay. If you are known, again, that recurrent, just random, I don't want to go here. I might have a panic attack. I might not know how to control it. I'm going to avoid the situation because it might be one that is easily avoided in order to avoid the panic attack. When do they occur? Suddenly and without warning. Okay. Be at the mall, spot your cute outfit. That doesn't matter. You could be sound asleep in the middle of math class. I said that wrong the last time. Sound asleep in the middle of math class. I guess that could happen. And they start to occur more frequently. Okay. So again, when we ask, oh my gosh, that came on so sudden. Was there any warning? You might get, that person that just had a panic attack might want to shake you. Because that might not be helpful. Again, if we had a warning, we might be able to do something about it. Many variations of a panic attack, but symptoms usually reach their peak within 10 minutes. It might not last that long. It could feel like it lasted that long. If you cannot breathe and you're struggling and you're not actually suffocating, your stomach is severely in knots, it could feel like it lasted forever. And you might be tired. So we find a lot of people, they are working so hard to either avoid it, get through it, that they are just so drained. It takes a lot of energy to make it through a panic attack and then deal with it afterwards. Symptoms of a panic attack, again, not going to read all of them. Again, feeling like I'm going crazy. I don't know what happened. I'm losing my mind. I feel like I'm going crazy because I cannot pinpoint anything that would cause this. The trembling, okay, you start trembling. A lot of times individuals start to go, feels like there's something really heavy on my chest. It feels like my chest is being compressed, and therefore I can't breathe. If you can't breathe, that causes panic. You might start sweating, and that heart rate might start to elevate. We're now in like fight, flight, or freeze mode. You may disassociate, right? You may totally disassociate from your body, or you don't even know what's going on, but your body might still be reacting. Doesn't mean you're hallucinating or having delusions. You are just so far in protective mode that your mind can drift elsewhere while your body is still experiencing those physical reactions. The fear of having another one. That, again, can keep somebody indoors or avoiding situations, I should say. If you're just constantly in fear that it's going to happen again, right? Just again, that anticipatory, what will I do? Can I even get out? Is there going to be an exit that's easy to get out if I start panicking? I'm just not going to go to the school play. I don't want to even have to risk having a panic attack, having nowhere to go, etc. Okay, agoraphobia. Eventually, perhaps stop going out in public because there's no way to know when it might happen or where it might happen. And so this leads to what's called agoraphobia. We're going to discuss it later in this PowerPoint. So this becomes panic disorder. Okay, now we're just not going to leave because we know we can avoid it, right? If we are safe in our house and it doesn't happen in our house, chances are we might choose to stay home. We don't know the cause of a panic disorder. And again, we've said genetics, major stress, they come on sudden, oftentimes without warning, typically triggered by certain situations. But again, the frustrating part can be not always, or we don't even realize that subconsciously we're being triggered. Okay. We might not realize that what's going on in a certain situation actually happened in the past. Okay. That could be locked inside of us. Okay. That's where EMDR we know can be really effective. We're going to talk a little bit more about that. Someone remind me, but I want to make it tie into it, not go off on a random tangent because I like to do that. Fight, flight, or freeze. Some research suggests that your body's natural fight or flight response to danger could be involved in panic attacks. And this is kind of a stupid example because if a grizzly bear comes after you, you don't want to run, okay? But if you're panicking, you might want to fly out of there, okay? I don't know how well fighting a grizzly bear might be or freezing. And I've heard that if a grizzly bear is coming, you're just supposed to freeze. I don't know. I've not ever had that happen. But many of the same reactions occur in a panic attack, and we don't even know why when there's no obvious danger present. That can be all the way back to childhood. Again, something that's locked, young adulthood, whatever. If we've experienced a trauma, even a smell. Okay, I don't know how, anybody like got a sniffer? No, a sniffer? Alyssa's mom has a sniffer. I have a sniffer. If I sniff something and I've sniffed it in the past and it was not a good sniff, maybe it wasn't either or. Your body can kind of say, the last time I sniffed this, I was over here. It's a dumb example I'm giving, but we sometimes familiar situations can come through sight, sound, taste, sniff, what have you. I got a big sniffer, got a big old gag reflex on me, that's for sure. Greatest risk of having a panic attack, again, starting off in late teens or early adulthood, affecting more women than men. We do know now that this language, had a panic attack, is starting younger and younger. I've got a child, sweet child, an anxious child. I think I had a panic attack today. I don't minimize it. But I was like, walk me through it. Walk me through what happens. Oftentimes it's like, yeah, your body felt, kind of dialed up, but I think you were really nervous about a situation. And that situation can be kind of scary, but you're able to walk yourself back through. So talking with parents about not minimizing the symptoms, family history of panic attacks or panic disorder. And if you have grown up and the people that are in your home or in your environment panic, their go-to is to freak out. And you've never seen someone remain calm or we're going to get through it. We're going to be safe. Naturally, sometimes that nature versus nurture, the nurturing environment, not always, can kind of increase the risk. Okay. Especially if the person who keeps you safe isn't there. My mom is here, even though she panics, she keeps us safe. So unsafe situation, kind of removing the stimuli that keeps you safe can increase it. Major life stress, again, death or the serious illness of a loved one. We know that oftentimes when a loved one, close friend, what have you, receives a terminal diagnosis, I don't know where the statistics are, we don't know when they could pass away, right? Sometimes we don't know when. It could be weeks, it could be months. Anytime they start to make a noise or seem like they're in distress, we could have a reaction to the danger of that person leaving. So if you're working with maybe a hospice and you're working with the family members or caregivers, sometimes, someone will say they started coughing and I think I had a panic attack. Yeah, you may have. If you are fearing the worst, which is the death of your loved one, you may start to panic as a reaction to not having a control over, not that you want to control someone's death, but not knowing when it could happen, maybe how it could happen, and if you might not be there to be with them. Other risk factors we know: traumatic events, sexual assault, domestic violence, or maybe a serious accident, major changes in your life, a divorce, death of a spouse, the addition of a baby. There's postpartum anxiety and depression. Increase, if your having a baby is its own bag, right? There's that transition. Having a baby that might need extra care due to heart defect. Baby has Down syndrome. Baby is really colicky or really sick. That can increase it because it's already maybe stressful to have a baby, maybe not. But if anything else is kind of on top of caring for the baby, risk factor goes up. And again, childhood physical, sexual abuse. I would also add emotional abuse. I think sometimes we discount how traumatic an emotionally abusive relationship or household can really increase our anxiety. Okay, if we are constantly fearing being berated, yelled at, even if nothing comes physical, we might be on high alert and get panicky. We might not know how that parent, caregiver, loved one might react. We know that if left untreated, it could start to affect almost every area of your life. Complications that panic attacks may cause or be linked to specific phobias. Okay, this is different than OCD. We're going to talk about OCD at the end of this semester. Again, after a while, fear of driving, we become more obsessive with it. We have to turn circles and circles and circles, compulsive behavior to feel safe. We're going to be talking more about OCD. Frequent medical care for health concerns and other medical conditions. This can be a big one, okay? If you were a child and you hated shots, I don't really know a lot of kids that enjoy getting a shot. You were held down. Okay, typically you're not going to leave my doctor's office without Nurse Kelly and Dr. K. They're going to give you that shot. They're going to be as nice as they can. Somebody's going to hold you down, make sure that shot. Being held down, getting something painful, that can really start to increase anxiety around going back to the doctor. Then having panic attacks as we're going back to the doctor. I have a major dental phobia. I had a traumatic thing happen when I was at the dentist. I'm fine. Everything was going to be fine. But getting back in that chair, smelling the stuff, I go up a notch. So whenever they offer me gas put the nozzle on even to clean my teeth. I'm just kidding. But I can get through a teeth cleaning. If I'm gonna have anything else done, knock me out. Not really, but just I notice myself getting panicky. I think one that I sometimes overlook is an increased risk of suicide or suicidal thoughts. Hi, Miss Lachitas. Thank you. And again, it's not that I overlook it per se, but when people just start to say, like, I'm just desperate to get over this. Like, I don't know how I can live with this any longer. Not that we're like, I don't know how you can live with it either, but you can see where somebody would, if you're not enjoying life, you can't leave, you are scared constantly of X, Y, and Z, scared of danger. You're a little kid that doesn't want to go to school because you're worried about school shootings. Sometimes our minds can go there, so I think we often think of suicidal thoughts with, or suicidal, ideation or active suicidal with depression and mood disorders. But oftentimes I think we kind of overlook that it can happen with anxiety. I tend to think of it as, okay, if anxiety and depression are walking hand in hand, but it could just be the diagnosis of anxiety, severe anxiety, panic disorder, what have you. Agoraphobia, again, avoiding those places or situations that cause you anxiety. Not being able to escape or get help if you have a panic attack. What happened with the dentist, I think back to it, and it was awful, but I was not all the way numb on my left side for a root canal. And I was a little bit numb in my hands from the laughing gas, but I could feel them drilling all the way through. And I wasn't able to say stop. And it looked like I was just like kind of gagging, and so I wasn't able to say stop until I was able to like fling my elbows. Literally leaning back in the dental chair, I can go back to that place of having a panic attack during that procedure. And now I'm left with age 45 needing an implant and all of my wisdom teeth taken out on April the 12th. I'll keep y'all posted on how that's going to go. I'm already preparing for it. I'm avoiding it. No, I'm not. I got to be there. The treatment for panic disorder, again, a lot of psychotherapy. Okay. Sometimes psychoeducation, understanding a panic attack, and how to cope with them. Now, I think it's very frustrating for individuals. We have our little, this is how we're going to cope with them. If you're kind of coming off the rails, a lot of times the coping mechanisms fly out the window. Okay. Did you do your deep breathing? No, because I couldn't breathe and my heart was racing and I was gagging. All right, never mind. What we're trying to get to is as proactive as we can to listening to our body, understanding when the panic attack starts. Well, if I knew that, I wouldn't have one. No, I'm not saying the situation. The minute, so I'll ask people, the minute you feel your stomach starting to kind of get a little woozy or your heart start beating, getting a little lightheaded, and you've noticed before that that was part of your panic attack, the earlier you can notice the one little symptom, we're trying to prevent all the symptoms colliding. Okay. And then at that point, we're trying to learn how to cope with them when they occur. When they occur. There we go. Again, when you ask somebody, did you do all the steps that we talked about last week? No, I didn't. I couldn't even remember them. Remember, I had trouble concentrating. Okay. Sometimes I'll write down on a note card and then people will rip it up after, like, that didn't work. Of course not. But I'll try anything just to put a little, put your hand on your heart, put your hand on your forehead, take a huge sip of water. See if we can't break the momentum. A DBT skill. I know nothing about DBT except for like one or two things. Splashing cold water on your face, trying to get yourself just a change in, I guess it'd be temperature. right? To kind of alleviate whatever symptom is going on, splashing water on your face, water on your arms, a lot of cold water. Now, where that can backfire, if someone's like, I'm not near cold water, duly noted. All right. You may have to take the water bottle and dump it over your head. No. But again, okay, then that might not be part of our care plan. So we kind of ask, do you have access to cold water? Are you able to sit near the exit? Okay. Now, that might not always be the case. In one class, I sit near the exit. In another class, I don't. Okay. Then we might not be looking at you always can sit near the exit. So coming back to learning to cope with different symptoms that occur along the way or all at once. Here we go again with the medication, similar to generalized anxiety, but also similar. We're looking at that Xanax, the Klonopin. We have just being mindful of habit forming. And if you're given 3 and you want some more and you go to the doctor at Costco and then they give you 2 and then the doctor at the care clinic and your other doctor, you know, we're starting to see a overlap in pharmacies where they're starting to flag it. Not all of them, depending on different areas of just that, why'd that person give you 3? This person only gave you 2. You got 1. Like, what were the reasons they were prescribed? And sometimes pharmacists will say, it's like you've been seeking them out and they have the right to refuse to give them to you. A lot of times, I didn't know this, y'all. I had no idea that at airports, we have more mental health emergencies than we can imagine. Mobile crises out to at the airport are big and out all day long. People come off the airplane and they are feeling it. Their Xanax has worn off. They start freaking out, start panicking. One of my friends works for mobile crisis. She was like, I'm out there back and forth all day long. You know, somebody had too much to drink while taking a Xanax. They are falling down. They're becoming belligerent. I kind of want to like go out there and watch it all. Just sit there, just people watch. I've never seen it. But then I was like, that kind of makes sense. That's such a terrifying experience to where once you are safe, your body doesn't feel safe and it's worn off, you can still be experiencing some of the overflow, aftermath, what have you, of the fear, especially if you're going into another stressful situation. I think I might want to work at the airport. I might set up shop at the airport. Bring them over here. Let's do a little debrief and see what we can't do. Here we go with the CBT again. Some of us are believers. Some of us are a little bit skeptic. I think it can work. I think that, you know, recreating the symptoms of a panic attack, not causing one, but just looking through, let's recreate this symptom. You're in a safe environment. Let's combat each symptom. Okay, let's see if we cannot find a way to deal with this symptom, even remind yourself that you're safe. EMDR. Was not a big believer in EMDR when I first took it. I may have told y'all 4 years ago. I did it out of peer pressure. Everybody was doing it and I wanted to feel cool and didn't want to be left behind because I still have a little bit of grade school girl left in me. And it took me a while to get on board, but where I've seen EMDR work, there's full protocol where you start back at the touchstone memory, and there's what's called brief protocol. Brief protocol is when you are processing maybe a recent event and you can't sleep. And 3 weeks ago, I was in the tub with my child as the tornado was whirling through our neighborhood. I can't get the sound out of my mind. I can't get the fear and the threat of safety out of my mind. So what EMDR does is we start out with the fear, or what's called the negative cognition. Me and my child could have died in the bathtub due to the tornado. Absolutely. What would you rather believe instead? Even though we were at risk, we were still safe. I knew what I was doing, and we ended up to be fine. So what you're doing with EMDR, someone's not in the middle of a panic attack when you have EMDR, can happen, but you're not starting out in a panic attack. You're trying to, with bilateral stimulation, get to a point where you're hammering home that positive cognition. Okay. And that positive cognition is the body's way of perhaps calming down. When you hear the tornado siren, it's in our backyard and it goes off once a month, every month to test it. For a while after a tornado, and you hear tornado sirens, and it takes a hot minute to kind of assess for safety. The goal would be that every time you heard the tornado warning being tested, you wouldn't start going into that fearful place, perhaps causing a panic attack. That's the ultimate goal. That's the dream right there. Once the physical sensations of panic no longer feel threatening, oftentimes the attack begins to feel resolved. Maybe you are no longer avoiding situations. It takes time and energy. Okay. And again, that's the $1 million question I think we're asked. If you're working inpatient, if you're working outpatient, if you're working in the school, how long is this going to take? I mean, I want answers. I want to know. Absolutely. You've been suffering from it for a long time. It may take quite a bit to work through it. If this has been part of your life for 6 years, probably 6 weeks aren't going to go by and you're fine. Maybe, but it could take several months to work through it. And that can be hard. We want to see results. If we're miserable or avoiding, avoiding situation. Speaking in public, okay. It's normal, right, to feel a little bit anxious or nervous in social situations. But now we have social anxiety disorder. We don't do it. SAD is not that one. SAD is seasonal affective disorder. So kind of making sure your notes line up. We spell it out here, word it out, social anxiety disorder, called social phobia also. Everyday interactions that cause significant anxiety, fear, highly self-consciousness, and embarrassed because you feel fear being scrutinized or judged by others. Okay, so really avoiding social situations where you might be embarrassed. Okay. Oftentimes the baseline is the fear of becoming humiliated, embarrassing yourself in front of other people. Oftentimes it's, I don't think I'll measure up. I might mess up when talking. I might not know how to interact with others. Maybe I'm a little socially awkward. So if we go into a situation already feeling awkward, doesn't necessarily mean that we are or going to be, but the fear of it might diminish our basic interaction, or we might start interacting and we just kind of, want to phase out if we don't know how we are interacting. And so sometimes it's doing a little bit of like social experiments, not that we go with somebody to school or wherever it is, but just kind of like, let's have a dialogue and let's just talk about conversing, and just ways to interact with individuals. You might see the movie Hitch. Will Smith.
Absolutely.
Absolutely. Okay, it's really funny. It's with Will Smith, and he's like a dating coach. And I think it's just funny. It makes me laugh. But observing how this guy, I can't think of his name, dates. And it's hysterical. Anyway, he has a little bit of a fear of dating because he's kind of done some blunders along the way. Again, kind of coming down to, will they notice that I'm nervous? Will they see my trembling hands? Am I going to sound different? And then people are going to kind of get caught up in the way you sound and not what you're saying. Giving a speech, public speaking. when I was in grade school, we'd have the reading book in front of us and you'd stand up and read that passage and then sit down and read it. Anybody else have to do that? When you're reading like a class story, it would be like each person took a paragraph and you'd stand up and read it. Hated that. I had a little bit of a stuttering problem. Sometimes I didn't, sometimes I did, but I would word trip. Shocker. Shocker, I know. Still have a little bit of a word trip, but that's stuttering. I would just be sitting there with my palms sweating, just like, oh, please don't make me. Maybe I'll just look like I don't know what I thought I'd want to look like, but maybe it won't happen. Or maybe we'll stop.
See, my teachers had the added level of popcorn reading. That was like,
Popcorn
next
reading.
level of torture. I was okay. I didn't mind reading in front of class, but I had friends who were very shy and could not. And the people that were nasty, like mean kids, would specifically pick on them because they knew they hated reading and like would, like, I guess basically initiate that fear response because they knew.
Yeah, they didn't like to read. Alyssa was saying popcorn reading, kind of just random times. You don't know it's coming. And grade school was hard. I look back and I just shudder. Like, popcorn reading. Oh my gosh, shuddering. And then of course, if someone's ridiculing you, reinforces that, right? Reinforces that social phobia. And we might avoid it. The eating part. We have a childhood eating disorder diagnosis of ARFID, avoidant, restrictive food intake disorder, where maybe we've choked on a banana, maybe we've gagged up a cracker, and we are in social situations and we stop eating. We start avoiding certain foods, or staying hydrated, because we're embarrassed as to how our body is going to react. So we're going to be talking a little bit, I think, about ARFID when we talk about eating disorders in the coming weeks. Symptoms, again, we've talked a lot about these. Want to focus on the gastro and extraterrestrial gas. I'm there, I'm like delirious. Extraterrestrial gas or gastrointestinal diarrhea, right? Our body keeps the score. Our GI can really get messed up the more our stomach starts to hurt. And that may be when you start to avoid certain foods, but sometimes it can be, irritable bowel syndrome. And then again, with the social anxiety disorder, could experience a full-blown panic attack. That worry of being noticed. So like Alyssa was just talking about, that popcorn reading, just that unwanted, embarrassing attention. And I feel like, gosh, I don't know how early it starts, but I feel like middle school, if you could just like shrink and just kind of like slither along and not be noticed, it feels like everybody is looking at you. I said something really rude to my daughter. They're going to notice. I'm like, I don't know that they will. What did I say? I didn't frame, but like, I'm like, everyone's too busy noticing themselves. They're not even going to notice you. And I was like, I should have. That wasn't a very good way. But a lot of times we're so busy noticing our own stuff that we're not looking around to catch everybody, except for those bullies. They're looking to trap people. Anticipatory anxiety. Man, just regarding upcoming events or situations. This can lead to poor performance. Okay. We've never even run the race and we're already, what if we fall? What if our time is off? What if this? What if that? We could just set ourselves up for a poor performance, going to have to anticipate everything that could go wrong. Now, someone with anticipatory anxiety, when you're like, but what could go right? They may want to slap you. A lot of things, people, trying to have solutions. So sometimes it's saying, let's walk through what it would look like to perform, not be perfect, but to finish the race, finish the test. What would it look like? What type of support are you going to have? Gonna have my coach there. I've got my teammates cheering me on. I know how to run hurdles. Um, I do this and do that. Okay, maybe, perhaps we lean into it might go well now that we have these protective factors in place. Tripped over every hurdle the first time I ever ran hurdles. I wanted to be a hurdle runner. Bam, bam, bam. My dad was dying. He laughed so hard. Never did that again. He was almost wet his pants. True story. So again, not saying to somebody that's irrational or unreasonable, but just kind of saying, how realistic would it be for that to happen? Or how realistic is that? Let's try to break it down. Have you ever worried more about something and it turned out to be okay? That might get you more of a nudge than a smack. But trying to say that absolutely your fear is valid. Okay, absolutely what you're feeling is valid. However, maybe it will be better the more practice you have, etc. 5 to 13% going to develop that. Once again, women outnumber the men with symptoms of social phobia. Negative experiences. Again, those who early on in childhood who've experienced rejection or ridicule or humiliation, more likely to develop a social phobia. Other negative events in life, family conflict, sexual abuse could be associated with a social anxiety disorder. So taking into account, if somebody, especially a little kid, I feel like little kids can sense danger more than we oftentimes give them credit for. But if they have been sexually abused by an older adult, meaning someone way older than them, they might be on high alert at a Christmas dinner, at Shabbat, at church, and might really start to dial up a little bit. Not to say that would have to happen with somebody, so we're not kind of assessing it, but just trusting that I don't want to hug him. I don't want to give Uncle so-and-so a kiss on the cheek. I don't want to sit on somebody's lap. I want to stay where I am safe. Okay. Oftentimes that is not interacting or engaging with so-and-so. Temperament. I kind of disagree with those who are shy, maybe at greater risk. The only thing I was kind of thinking of with the shy part is if it causes you to withdraw from situations, kind of get that social isolation, and situations where maybe you might enjoy yourself. Work demands, new situations, oftentimes they are have roots in adolescence. Having a health condition, okay? Facial disconfiguration, stuttering, other health conditions that can increase just your self-consciousness of how people are going to react. My best friend is successfully beating brain cancer. We do not know how. The tumor is shrunk. In order to get the tumor shrunk, she had to have medical induced, it was medically induced Bell's palsy. It's just going to cause a total relaxation from the eye all the way down to the lip. Her face looks completely different than it did. We all think she's beautiful because she just is, and she's surviving. That was hard to be in public. Perhaps you could draw attention. People don't know what to say or how to react. She did not like when masks went away. She kept on wearing a mask. We were like, you've been back, all the things, and didn't even realize till she was like, it just covers up the worst part of it. Changed her speech a little bit, and just kind of the anxiety of going into social situations where people haven't seen you. She's recognizable, but definitely looks a lot different. Okie dokie. We are going to back to, gonna pause. And my face. Okie dokie. Next slide. So where we are is, when does social anxiety begin? Teenage years, and a lot of times people suffer in silence or quietly over the years. If you don't know how badly it's affecting you, or it just feels normal, right? This is just how I am. I'm just nervous with this. I'm anxious. I'm worried, fearing danger. And then only looking for help or support when we're going through something, major life crisis, major trauma, etc. What causes it? Lots of things we think. Interaction of the environment and our genetics, could be the hereditary of running in our family, could be due to, there comes the amygdala, okay, could play a role in our fear response, especially if it's overactive, causing increased anxiety in social situations. So, little party talk here. It's your overactive amygdala. It's almost gonna smack you in the face. Environment could be a learned behavior. We talked about that at the beginning, but witnessing the anxious behavior of others, maybe an association between social anxiety disorder, or parents who are more controlling or protective of their children. I struggle with this. One of my biggest fears is just anything happening to my kids, and I have to balance that with being overprotective, and then scaring the life out of them. Okay, look both ways 10 times before you cross the street. Okay, at the park you might run into a pedophile. Things like that that sometimes I might be creating for my kids, of being overly anxious, or maybe that's a little bit controlling. If it goes untreated, again, not going to read off of all of these, but just that lower self-esteem, kind of missing out on life, or enjoyable possible situations, perhaps poor social skills, perhaps, perhaps substance misuse, if we're using drugs or alcohol in social situations, maybe become dependent, or maybe we act a certain way that is maladaptive. Okay. And that's, doesn't ever serve your social anxiety well. If you thought you were calm and you acted like a fool, the next day you're wondering how you acted. Going back to that psychotherapy approach and the CBT, gradually working up to face the situations you fear most, in hopes of improving your coping skills. And once we develop more coping skills, the overarching goal is to have the confidence to go through social situations, or try something new to deal with our anxiety. Medication, yes, we know it can help. And again, just being on the lookout for what is prescribed for what. Obviously the infrequent use of those that become addictive is what, can get kind of concerning, as we want them to be used in certain situations. Hopefully the social anxiety may fade over time. The ultimate goal is, once we have faced enough social situations, they've gone well, we faced a number of them, that's where I've seen medications kind of be reduced. And some individuals need medication for the rest of their lives. Nothing wrong with either. I always pivot back to who's prescribing it. You think I should come off this medication? I don't know. Perhaps ask your provider. Okay, selective mutism. Man, in the schools, we're looking at Portia, you gave us that example a couple of weeks ago. It's rare, related to a social phobia, most often with kids, a consistent failure to speak in certain situations where speaking is expected. So school, playmates, maybe if you're on a team, despite being able to speak in other situations. So she talks fine at home with her close family members and her cousins, while she does not talk at school. It can interfere with school, social functioning, playing on teams. Sometimes with teachers, it can be frustrating. It can feel like they're being disrespectful, not listening. So sometimes working with teachers on, let's just see what else is going on. Maybe little Katie Vite is just super, super nervous, and doesn't feel safe to use her voice, etc. Not being shy. Okay. And this just being shy, not necessarily. How we diagnose this is must last for at least 1 month, but not limited to the first month of school. Okay. So we kind of think during that first month, you're trying to get, kind of a layout of the classroom, sniff out social situations. So you might be more reluctant to speak or speak up, because you're just seeing who might be your buddies, or might be looking around to see who might make fun of you, or if they're even going to be some popcorn reading. Not social mutism. If the individual's failure to speak is due to lack of knowledge or comfort with the spoken language required in social situations. Okay. Oftentimes, we might not look at somebody's, maybe their IEP or any paperwork to see, hey, they don't speak a lot of English, or English is their second language, sometimes third language. Therefore, they're still figuring out phrases, terminology. So we do not diagnose selective mutism if that's the case. Not also diagnosed if it's better accounted for by embarrassment, a communication disorder like stuttering, if it occurs during autism spectrum disorder, schizophrenia, or other psychotic disorders. So those social situations that we can find ourselves in. And when it comes to ASD, where we lack sometimes the social skills to navigate what the situation is going to look like, perhaps we just remain silent. Specific or simple phobia, intense, irrational fears of certain things and situations. Okay. Dogs, spiders, tunnels, flying, driving, vomit is a specific phobia. My third child, highly anxious child, super scared of vomit. And we have some car sickers in our house. At least 4 out of 6 people vomit when we're in the car. It's been her. Her vomit smells and looks different than everybody else's. We always say her vomit don't stink, but smells, look, sounds. So a lot of times on road trips, we're packing the Vicks Vapor Rub in her nose and vomit bags, all the things. But sometimes we are going to have to go somewhere where we're going to have to drive or fly, get in elevators. And so sometimes it's exposure therapy. I don't know much about that. I do know people are using exposure response therapy to treat that. I don't know how that works with spiders necessarily. Part of me is like, are we all scared of spiders? I don't know. But dogs, chances you might want to play with that friend and they have a dog that can't go away, and you're going to miss out on going there. Claustrophobia, extreme fear of being in confined spaces or being closed in. There's no way to escape. Okay. In this small area that I might not be able to get out of. The difference in a fear and a phobia. Okay. So fear, I love normal, but a normal reaction to a frightening situation. Phobias aren't necessarily just extreme fear. They can be irrational fear. So you may be able to ski the world's tallest mountains with ease, but panic going above the 10th floor in an office building. So that's where sometimes if you love somebody with it, you'll be like, well, come on, you skied the world's tallest mountain with the greatest of ease. And it just doesn't make sense that you can't go to the 10th floor of the office building. Well, maybe I feel like I could be more trapped in the 10th floor or the elevator. So even though we can think that they are irrational, it can still bring on a panic attack or severe anxiety. I worked with somebody one time. This is horrible, absolutely horrible. Fear of elevators. And her family said, they're like, we are going on a trip and the room we are staying in is at the 22nd floor. Nobody will be taking the stairs with her, up or down. We got to haul out the luggage up or down. Hated being in elevators. She'd seen a movie where someone was trapped in the elevator where it like is stuck between floors, you know? So not knowing jack about exposure therapy, I said, you know, let's work our way up to taking the elevator in my office. And it's a rickety old thing. So it's kind of a good example of, it's kind of bounces a little bit. Stuck on there for 2 hours. Had to use the emergency, but you're 911. It's like, we're stuck on this. I mean, screaming. This kid was screaming bloody murder. We made it out safely. She was okay with a lot of work around how we reacted, getting out safe. Dumbest move I ever had done. That was an example of exposure response therapy. Being a new clinician and just Googling my way around it, not the best way to go. But oftentimes it is facing that irrational fear and getting through it. But who likes spiders? Strikes more than 1 in 10 individuals, usually appear adolescence or adulthood, tend to be more persistent than childhood phobias. When children have specific phobias, for example, a fear of animals, sometimes, and usually, not always, but research says usually disappears over time. It could continue in adulthood. If you've always avoided dogs successfully, might not be scared of them because you don't come in contact with them. You get to adulthood and it's, you're going to go to somebody's house with the dog. Here we are kind of again faced with a situation where working through that fear. It's really hard when someone has been attacked by a dog. That's super scary. If you've been attacked by a dog, obviously that is a rational fear. It could happen again if it was painful. So that sometimes gets in a back and forth of, have this, come about. And a lot of times these are irrational fears. And the kid says, well, my mom was like brutally attacked by a dog, or we were really attacked by the neighbor's dog. Okay. Doesn't necessarily mean it can't be treated. But when something has happened, like being stuck in the elevator with your therapist who is banging on the 911 call button, or someone's been bit, what have you, then if your greatest fear has come true, let's say, it can be a little bit more challenging to treat. I wonder if that client took the 22 flights of stairs. I didn't see him much after that. What happened to that? What causes it? We still don't know. Now, we find a link. There is a link between your own phobia and the phobia of your caregivers or your parents. This could be genetic. It could be a learned behavior. Okay. Somebody is, always panicking when the tornado siren comes on. Chances are that signals danger in you. I know that again, during COVID, when you've been sheltering in place for a really long time to keep safe and you're watching the news and a little kid is watching the news and we're talking about it constantly. This many people passed away. We don't know what's going to happen with this. Going back out into school, if you've been out for a year and a half, can turn into a phobia. If those around you are constantly panicking about getting hurt, getting sick, worst case scenario, passing away, that might be how you react at school when people start to talk about COVID. Specific phobia, uncontrollable panic, terror, dread when exposed to the source of your fear, doing everything you can to avoid what you fear. The inability to function, again, I don't love normally, but go to school, go to work, be around dogs, what have you, because of your anxiety. Therefore, you're going to avoid what you fear. I don't know if anybody's scared of escalators. Sometimes that elevator isn't always there, but those escalators can be kind of scary. If you've ever gotten your shoelace caught in an escalator, talk about fear. You're at the end and you're like, ah, it's going to eat me, because it does. Anyway, I'm scaring people. Physical reactions, overlapping with others, the other reactions to anxiety or panic. Sweating, that rapid heartbeat, again, that difficulty breathing, maybe feeling like you're going to have a heart attack. Just kind of gaining the knowledge or confidence that those fears are unreasonable or exaggerating, but feeling powerless to control them. So we can both cognitively know that's an exaggerated fear. That's completely unreasonable. That most likely won't happen, but it feels powerless to control them. Anxiety in children, okay? Tantrums, clinging or crying. Our pediatrician said that, this kind of helped reframe it. When a child is throwing a tantrum, especially when they can't communicate what they need, oftentimes it might be out of panic. So he said, if you look at a tantrum as like a little mini, little mini panic attack or an anxiety attack, whichever one, people misuse them, then maybe you'll have more sympathy. Or maybe they're just a butthead. They don't want to do what they want to do, right? But sometimes when we don't want to go to school, we might throw a tantrum. We might scream and cry, kick. We might cling to the parent. We're going to do whatever we can to have power over the situation that we don't want to enter. What factors put you at risk? Seeing this often, women are more likely than men to develop a specific phobia. Going back to those relatives, more likely than not, if someone in your house has a fear of spiders or snakes, you could too. So just watching how other people react to certain situations or an object, and then how they keep on reacting. On the flip side of that, how they start to cope. So it's not impossible if a parent has been panicking or having a specific phobia, and this is how they've reacted. It's completely possible to change your reaction, therefore helping your child see that they can change their reaction. Here we go with the temperament again. Okay. Again, I kind of go back and forth, like more sensitive. I think sometimes that's like empathetic. You feel things like really, really deeply, which means you absorb a lot. Again, more negative than the norm. I'll never be able to do it, can't achieve it, it'll never work. I'm going to fail the test. I'm going to, fall down during my speech. Okay. That might lead to poor performance if you think about those things constantly happening. A traumatic event, trapped in an elevator with your therapist, trapped by an animal or attacked by an animal, could trigger a development of a phobia. I like that graphic. Everything you wanted to know about phobias, but were afraid to ask. Is that a phobia? Asking questions?
Mhm.
Perhaps, yes. If teachers or authoritative people have put you down, could have a fear, specific phobia around getting help. if it hasn't worked for you before, right? I don't want to ask for help because it didn't work out over and over and over. Left untreated, um, again, it could be silly for those you live with, work with, partner, spouse with, that it's going on, but it can be devastating to those who cannot overcome them, causing problems that affect a lot of different aspects of your life. One of those being social isolation, um, avoiding those places where even people we like, people we enjoy being around, but we're worried about running into the dog or having a panic attack, um, at risk of academic problems and loneliness if you don't want to go back to school. This was a big one. I don't know if y'all saw this after the pandemic, but there was a shift to just kind of, I want to continue to do school online. And it's hard. I feel like people went back and forth about it because it's like you need socialization and it's good to be around people. And, overall, it's good for your social skills and you're going to feel lonely. I think all of that can be true. I can also see how if you were scared to ask for help or people made fun of you, you felt like you were always behind in class. How safe would it feel if you got to kind of stay home, do your thing online? Nobody made fun of you. Maybe a parent was there to help you. So kind of going back and forth about what is best practice with that. And it feels like it's just really subjective. We're going to talk a little bit more about that in a bit. Again, could lead to stress. I'm sorry, not stress. The stress could lead to depression. It's depressing. I used to love being at school or being around other individuals, but I'm so scared I'm going to have a panic attack. I'm starting to feel depressed. Again, utilizing substances to kind of cope or numb, that can interfere with everyday life, and how you perform or interact. What treatment exists for specific phobias? We know that research says that most adults don't get better on their own and could require some type of treatment. The overall goal of the phobia treatment, reducing your anxiety and fear, hopefully to help you manage your reaction to the situation that causes them. So again, I'm going to kind of go back to the EMDR example. In a perfect world, that fear would be gone and we'd have no reaction to the tornado siren. In a more realistic, kind of realistic situation, maybe you still had a little underlying fear, but when you heard the tornado siren, you don't start to have a panic attack and go back to that place of hearing all of it. So it's just to overall like reduce or manage the reactions to the situation that causes or caused them in the first place. Medication's going to kind of blow through this here. Psychotherapy, desensitization or exposure therapy, changing your response to the object or situation that you fear might be helpful. Gradually, and I probably didn't do it gradually enough, repeated exposure to the cause could help you learn to conquer your anxiety. We go from thinking about getting on an elevator, looking at pictures of elevator, going near an elevator, stepping in it, and getting stuck. No. Hopefully finding that you made it successfully taking a ride on an elevator. It's hard to promise people like there's going to be this alarm and this phone and that phone, just have to assess as we go. So that can be kind of that. Thought there was going to be, the magic phone and this and that. Hopefully, but preparing to get on the elevator if those things are not necessarily in place. Exposure, we have the little, the far side here, confronting heights and snakes. Looks like maybe in the dark. Again, people we all have a different maybe opinion through that. Hopefully it lessens, but I think kind of the pushback is, what if that's re-traumatizing? And that's why you want to do the exposure therapy with someone that has been trained, and it's a lot of training to do exposure therapy, so that they know how to manage all from start to finish and all the reactions that can take place. Stranger anxiety, a fear that infants commonly display between 8 and 9 months. They become upset or a little bit meek, or kind of, might hide or cry when meeting an individual for the first time, particularly when the parent or caregiver or guardian is not within immediate reach. So we think of, like, I always think of a baby where they lunge, they have sometimes no sense of they could fall out of someone's arms. Sitting on Santa's lap. I do not think any child should be made to sit on Santa's lap. I was made to sit on Santa's lap for years. Everyone thought it was funny. Up until I was like 12, I cried. I'm kidding. Those first few years, just like crying. And so again, not necessarily making somebody do something when they sense danger. The stranger anxiety is a normal part of development and not a disorder. Okay, so it's not stranger anxiety disorder, but a normal part of development. Separation anxiety. Oh, they've gotten older and they should have outgrown having concern about separating from their parent or the home. They're scared, right? That parent is a source of comfort. I haven't measured it yet, about separation anxiety and how old individuals were after COVID, with 1.5 years of maybe being home with a sibling, a parent, a grandmother, a cousin, what have you, and leaving after 1.5 years of always being around that person, not being exposed to different situations, having a harder time separating. Definitely we look at like little kids that were like 3.5 that had like started learning the lay of the land of like daycare, and not being in daycare for 6 months to 1 year, what have you. They're 4 years old, a whole year has gone by. Maybe we're starting over. And again, this isn't on the average age of 4, but maybe, what the daycare is seeing. By the time the child is 4, we're not having as much separation anxiety. I'm a weak one. My kids want to leave. I'm like, all right, let's get out of here. No, I feel bad. I'm very clingy to them. This is really interesting. It's a very weird, not really weird, but I guess I have a little bit of separation anxiety to my kids. Definitely. Duh. You do? Yeah.
It's funny because me and her dad were arguing because of the thing for the weekend.
Yeah. I don't like leaving my kids. I start to panic. There are just times when we have to leave them, but I feel like as much as sometimes they have had it, I have had it. When I was doing EMDR, when you train for EMDR, you go through EMDR, you walk all the way back in time to your earliest touchstone memory. And I remember my earliest memory was sitting outside. My mom and I were like super attached. We did everything together. I was kind of like a little adult, like we didn't have anywhere to be. We watch TV, we wake up late. We were just best buddies. We still are best buddies. Bump heads every now and then, but best buddies. But when my mom had my brother, we had this rocking chair and I like to sit on the arm of the rocking chair, but it was hard for my mom to breastfeed my brother. So they bought me a swing set and they put it like right outside the door. I could see my mom through the door and she'd wave and be breastfeeding. And one day I wanted to come in and the door had accidentally latched. And I can remember to this day beating my fists and my hands. My mom was like, I thought you were going to come through the glass door. Like strength could have taken over. She was flustered trying to remove my brother. That's why I'm jealous and hate my brother. Just kidding. That came up later on my timeline. No, why we have so much jealousy, but it like when I was reprocessing that event, that I was like, was that really that traumatic? Right now, it's not traumatic, right? When I was a little kid, highly traumatic. I couldn't get to her. She couldn't get to me. So when I was reprocessing it, all this stuff came up around fear of safety, kind of wanting to know people are safe. I have an obsession with, I want to know you got there safe. I can feel myself kind of get panicky if I call somebody, they don't answer when they're supposed to answer. I don't go off the rails, but I definitely have a little bit of fear of my safety and those that I love. Person that was leading EMDR was like, that might go all the way back to feeling so unsafe. And when you're 3, early in development, you're not concrete operational to know if the door locks, you can't get in. When you're little, you only think there's no way in, just like there might be no way out, your rational brain. So we joked about that for a long time because I was never put outside again. And my parents' back door to this day does not lock. My dad like broke the lock and you can't even lock their back door. That's even weirder on safety. No, but just so scared. More common in children. It can also occur in the teen years and adults. When you're anxious about being separated from the person you are attached to. Okay, so we can even be adults and maybe you and your partner or your spouse, significant other, are used to being around one another. And what we see at times when we've researched this, when someone goes off to war, the safety is threatened, right? We might not know when they come back. It's just a fear, the danger, so oftentimes we see the PTSD of the person who's being left behind just as much as we see the PTSD of the person leaving. So a lot of, over the years, support groups have been created on bases just for the people who are being left behind, who've been attached for so long and really not gone day to day, maybe longer than a week or so, or it might be 8 months, might be to a year. So the fear, the anxiety or avoidance is persistent, lasting at least 4 weeks in children and adolescents. And typically the timeline is 6 months or more in adults is our criteria there when we're looking at timelines. What are the symptoms of separation anxiety? Constant worry that something bad is going to happen. Okay. Separating from parents, being lost or kidnapped. I did go through a period of time at the mall where if I couldn't see my mom's hand to be held, I'd flip out. I don't remember that. All I remember is my brother going underneath the clothing rack. He would ruin everything. He ruined everything from the day he got me locked out. He's the cause of all of it, really. Repeated nightmares about separation that are so vivid. Not wanting to be alone with a parent in the house. And then those physical symptoms. Worried about going to school without my parent. My stomach hurts. I might have a headache, or other symptoms that come when separated from, I would add caregiver, the loved one, say big brother, big sister, if you're always used to being with them and enjoy being with them. what feelings does a child experience? It's just depending on their age. These could be other situations that present danger that are real, right? Being kidnapped, car accidents. Very common is death and dying. Okay, because we know that once we become more concrete operational, we lose loved ones. And we might have, refused to go to school where we don't feel safe. Maybe nobody loves us or cares about us. We might wish we are dead. My mom used to say, like, everything gets worse when the sun goes down. In the evening, we have, that darkness kind of increases sometimes those perceptions, maybe scary creatures. And again, kind of what that, strange eyes looking at them, all the things. It's, oh, your imagination's playing tricks on you. Maybe, but again, minimizing that isn't always the most helpful. Maybe trying to work through it. If you're a tired parent, may want to minimize it and open the closet door, turn the lights on, and show everybody that there's nothing there. Seeing people peering into your room. What causes it? Changes in our lives. A new sibling, see, ruined my life. That it just took me down, caused all my separation anxiety. A traumatic experience, when someone's almost killed. We know that survivors, really at any age of those with cancer or what we thought was a severe and persistent illness, it's not getting better, can cause separation anxiety, especially after the person passes away. We're probably going to find that next safe adult, not always, and could cling to them. Okay, we've had a major loss. Nearly killed, car accidents, things like that, where our lives are at stake. Almost 3:00. Treatment. Again, medication, sometimes therapy can be harder because if they're too little. Practicing techniques when, if I'm gonna be leaving, practicing saying goodbye, timing the departures carefully, giving the child something to look forward to. We're gonna go for a special hike, or I'll bring you this candy, what have you, just to try to help them get through the time that you're gone. Doesn't always work. I never wanted my mom to leave, only because of my brother. He ruined it. She could bring me anything and I'd still be upset. Oh my gosh, we made it through 83 slides. I'm going to push stop recording.